My guest today is Dr. Robert Thornton. How are you doing today?
Fine, thanks, Ryan.
Okay. So, doctor, what is anxiety?
Anxiety is a heightened state of arousal of the whole person. So it would involve the thinking, cognitive activity, it would involve emotions, anxious sorts of feelings, and it would involve physiological arousal. So it would sort of be like revving an engine and really getting those RPMs up and running. And essentially it kind of comes from deep in the brain and is our fight or flight response. So if we sense something that's threatening, then our bodies automatically prepare to either engage that threat or to run away from it, to escape from it. So that means physiologically that all the systems are up. So heart rate, blood pressure, perspiration, respiration, blood flow to the extremities, and so on. All happens automatically as a result of stress hormones that start pumping into the body once a threat is perceived.
Okay. Now, what is depression?
Depression is, not surprisingly, more or less the opposite of what I just described, where all systems are down. And again, depression is a whole person experience. So it involves depressed mood, which would involve sadness, moodiness, maybe a variable mood at times. Usually it's diagnosed on the basis of symptoms that are seen over a 2-week period or so, more often than not. So there are certainly physiological signs of depression. People might have difficulty sleeping, either too much sleep or not enough sleep. Appetite may increase significantly or decrease significantly. Interest in sex may increase significantly. Typically, it would be more of a decrease of an interest in sex. So those would be some of the physiological signs. It also involves cognitive activity. So there's a depressed way of thinking. Sometimes we hear people talk about people who see the glass as half empty. You know, that would reflect the kind of way of thinking that's rather depressed. So a person would see herself or her life circumstance in a rather negative way, wouldn't see her options or possibilities as being very positive or good, low self-esteem. So we're looking at a combination of emotions, physiology, and thinking that would reflect all systems down. And again, largely and most often characterized by a pervasive depressed mood.
Okay. So besides some of them that you've already mentioned, what are some of the signs and symptoms of both anxiety and depression?
Yeah, I probably mentioned a lot.
I probably did mention most of them now
already, but again, with depression, typically you'd be looking at depressed mood, sadness, lack of hope in one's future, sometimes suicidal thinking.
Sure.
Doesn't mean that a person's necessarily going to commit suicide, but they may be thinking what we sometimes call passive suicidal ideation, which would be, oh God, I just wish this was all over, I wish I were dead, without necessarily a plan or intent. Although some people can be seriously depressed enough that they may wish to attempt suicide, so sometimes it does result in an attempt or a successful attempt at suicide.
Are there any physiological signs? I know you were saying there were some of anxiety. Are there any sort of physiological signs of depression? Yeah,
the things we would typically look for initially in terms of physiological signs would be changes in appetite, changes in sleep patterns. Could be greater appetite, lesser appetite, more sleep, less sleep. Typically less interest in sex or sexual activity. And for some people, actually pain. It might be difficult for them to locate the pain, but there is, for some people, an experience of physiological pain that's associated and as a function of depression rather than some other pathology.
Now, have you seen any sort of trend recently in the diagnosis of both anxiety and depression?
I think it's safe to say that as life has increased in complexity, let's say over the past, just to use 50 years as a rough time frame, life has gotten more complicated and, relatively speaking, more stressful. And depending on how people handle stress, I would say that there probably is some increased vulnerability and increased incidence of depression and anxiety over the past 50 years, at least in our own culture.
Now, I know we spoke about the signs and symptoms Are there different levels of anxiety and different levels of depression that one can have?
Yes, there's certainly different levels of intensity. So someone might have a diagnosable anxiety disorder, what we call a generalized anxiety disorder, which may be mild, moderate, or severe. The same would be true of a major depressive disorder, maybe of a mild type or moderate type or severe in terms of the intensity of it. There are also other kinds of depressive diagnoses and what we call subtypes in terms of depressive diagnoses, or different types of anxiety disorders. So in addition to generalized anxiety disorder, in that category of anxiety disorders, there would also be things like obsessive compulsive disorder, which is basically an anxiety disorder that expresses itself in different sorts of symptoms, all the way up to post-traumatic stress disorder, which is characterized as an anxiety disorder. So there's different types of disorders within the anxiety category. The same would be true of depression. And in addition to that, within the category of mood disorders in general, there's bipolar disorder, which can take various manifestations, has various subtypes as well, which can include both depression and manic symptoms at times, sometimes just one or the other.
Okay. Now, how would a person know when to start seeking treatment for one of these two types of disorders?
Generally, in terms of diagnostic criteria and looking at these kinds of symptoms that we've been describing, it would be a question of the degree to which a person is aware that it's impairing her occupational or interpersonal or personal functioning. So how we are in the world, how we get through our personal lives, how we deal with our work, and so on. If symptoms begin to impair that functioning in any areas, then it would certainly be time to seek help. Sometimes it's just a matter of being in a lot of distress and pain, and hopefully that is enough to help people seek help, or it's noticed by a family member or a friend who might then encourage the person to say, look, maybe it's time to talk to somebody.
Sure. Now, when treating both anxiety and depression, is medication always necessary?
Not always. In both anxiety and depression, cognitive behavioral treatment strategies are very effective. All the way from, say, a simple phobia, say you're afraid of heights or afraid of snakes or things like that. Those, in many cases, can actually be cured because the anxiety is focused on a specific thing or a specific circumstance that raises the anxiety significantly. In other cases, other kinds of cognitive behavioral interventions are very helpful, and sometimes they on their own are sufficient. In the research on this, particularly in research on depression, it's been found that for a person, say, with a very severe depressive disorder, a combination of medications and cognitive behavioral interventions tends to be the most effective. But sometimes simply the cognitive behavioral therapies are sufficient to correct the problem.
Now, if a person does have to take medication, would they have to be on this medication for a prolonged period of time, or say for the rest of their lives?
In some cases, people might be on medications for the rest of their lives. More often, I think, if a medication is begun for anxiety or depressive symptoms, a psychiatrist would want to see a person on that medication for at least 6 months and see if there's any effect to that, any really negative side effects, sort of see what's happening or not before they would consider adjusting dosages or discontinuing the medication altogether. I'd say even 6 months to a year, if at some point medication is considered desirable or indicated, then you'd probably be looking at a 6 month to a year period at least. After that, it really depends on the individual. And there could be an extended time on medication or not.
Okay, so it can depend on how they respond to the treatments in the first 6 months to a year.
Yes, and it might also be influenced by whether or not the person is also receiving other kinds of psychotherapy like cognitive behavioral therapies, and oftentimes that would enhance and improve the positive effects of the medication.
Okay. Dr. Thornton, thank you very much for
My
joining us.
pleasure. Thank you.